Good afternoon. You are welcome to our today's class. Today, take a look at PHC 201. In our last class, before the break, we discussed the family planning methods and different methods of family planning. So today we move on to the advantages of family planning. Advantages of family planning. We move on to the advantages of family planning. All right. So what are the advantages of family planning? What are the advantages of family planning? You know, family planning has a lot of advantages, especially considering the economic situation of the country. Most especially, anytime you mention family planning, that is where our mind goes to go to. How we'll be able to do what? Space out the birth, at the same time, have a control of number of kids we give birth to. So we give birth to the number of the kids that we'll be able to take care of to avoid economic burden that we may not be able to bear. Alright, so family planning offers numerous benefits for individuals, for families, at the same time the societies, individual, the family, and the society. Okay, so here are some advantages of family planning. Some advantages of family planning. They are as follows. They are grouped into different categories. We have those under health benefits. So let's look at advantages of family planning in the perspective of the health benefits. So what's importance is it of any advantage to health benefits? Yes, number one. Yes, family planning help to improve maternal health, because it's from the mother that these children are coming out from. So you need to actually be able to help the mother to recover. So if you space out or at the same time, controlling the number of kids you have, at least the health of the mother will be improved. Yes, because it's not easy. 9 months and also labor is not an easy task. So to improve the health of the mother, improvement, it ensures improved maternal health. Also reduce infant mortality. It reduces infant mortality. If you don't start properly, it will be an issue. There is a serious issue related to the health of kids you give birth to. You may not be able to feed them well, or a lot of things are involved. So it also helps in the prevention of sexually transmitted diseases, infections. Yes. Some of them are barrier method, something like condom, barrier. At least I'm not only preventing preventing pregnancy. It also prevents diseases. Yes, even though it's not natural, but at least it can help to do prevent diseases. Some other family planning methods we discussed can actually prevent transmission of infection, sexually transmitted infections. The next one is it reduces the rate of unintended pregnancy. Yes, unplanned pregnancy. So um, um, there are many of them. There are many of them that can prevent unplanned what pregnancy. I don't want us to go into them again. Condom is one, and many of them. So I wouldn't want to go into them again. Also prevent what pregnancy, because if you don't cycle well, you know when the sex, know to have sex and when not to have sex. If you don't want to give birth to, if you don't want pregnancy, you know the right time to have what sex and when not to. So apart from the natural one, other artificial ones we discussed. I don't want to go into what we discussed so far. But with this point is key. You align with me. You believe or agree with me that family planning methods, family planning go a long way to help what in prevention of what unwanted what pregnancy. All right. The next one we'll look at is economic benefit. Let's look at the economic benefits of family planning. You plan your family well. You give birth to the number of kids you can take care of. If you want to, you know your finance, you know that your economic status. Even the idea of this is that the people wealthy ones, elites, those of the upper class, those that are in wealth, you see them just one kid, two kids. Is that not funny? Then those that are managing, spending on $1 or $2 per day as daily living, you see them giving them to 10, 15, 8, 7. Is that not funny? What an irony. Those that were supposed to actually know, be careful about how they give birth, are now the one that give birth up to 10. And you see them in the streets doing nothing, joining bad gangs and constituting nuisance in the society, because of course they will not have proper training. That one is for sure. All right, so let's continue, please. So what are the economic benefits? It increases economic what? Productivity. Yes. It also reduces poverty. Yes. Because if you are managing your meager salary and give birth to 10, you are putting yourself in poverty. You are bringing yourself down to the poverty status, because you may not be able to cope. So, but if you know if it's only one, you can cater for. You give birth to one. If it's only two, you give birth to two, and rest. You'll be able to do what? Take care of them and manage your finances well without plunging yourself into what? Poverty. Right. So it also improves education and career opportunity. Yes, it improves education and career opportunity. So if you have 10, you cannot send them to school. So what have you achieved? Their education will be zero. But if you give birth to one, you are sure that you see that one through to the university level, and the person will become successful in life, career-wise and otherwise. Of course, when your education is like getting you prepared for opportunities, because when preparedness meets opportunity, success ensues. All right, so it ensures improved education and career opportunities. It also reduces health care costs. There's a reduced health care cost. If you plan your family well, there will be a reduced health care cost. Because the health, if you have 10, this one will be having malaria, this one may have diarrhea, this one may go out and play roughly and have injuries and come back. Whereas you are even struggling to even eat. Now tell me, how will we be able to take care of them? And at the same time, there will increase health care costs. But if you just have one, two, the health care costs will come down. Alright, so let's look at the social benefits of family planning. Social benefit of what? Family planning. Yes. The benefit there, if you plan yourself well, your wives, our wives and the girls, our wives, women and girls will be what? More empowered. Yes, they will be what? More what? Empowered, because they will devote their time to other important things, not only giving birth, because they are not baby making what? Machines. They are not what? Baby making machines. They have other career progression, they have other things to do, contribute meaningfully in the society, not just to be giving birth, because they're not baby making what? Machines. All right, so the next one is what? They have improved what? Family relationship. Very important. Improve family relationship. There's one thing we need to understand. Sometimes issues in the family may be as a result of so many children, a lot of stress, financial issues. The children are disturbing the mom, the mother is disturbing the father, and the father, there's no money. They are thinking how to raise money to take care of the children. Any small thing, any small mistake, they will just lash, be aggressive towards each other because they're not happy. You see a family that have been doing well, love everywhere. Once they start having issues, once they enter into financial issues, you see them becoming hostile to each other. It may not necessarily be that they don't love each other, maybe because of the lack of funds. And having too many children you can cater for in a family can lead to this situation. It can lead to this situation. So let's work on that. So it improves family relationship. And also, if you also have time to even look at the extended family, because your immediate nuclear family, you don't have much children to bother yourself about. You start looking at other extended family members to take care of. So it actually improves family relationship. The next one is that it reduces domestic violence. In fact, I've said it before now. It reduces domestic violence. Where there is money, where there is funds to take care of responsibilities in the house, you see everything is moving smoothly. We are happy, the man is happy, the woman is happy, the children, they're happy. You rarely see the man raising his hand on the woman. You rarely see the woman, being aggressive towards the man, because everything is moving on smoothly. So it reduces family domestic violence, because this domestic violence sometimes may not be intentional. It may not be what the man planned to do, or even the woman planned to do before, but because of the stress, the burden, the aggression everywhere, and when the house is heated up, they may end up fighting. So it reduces domestic violence. Next one is that it increases social mobility. Yes, if you want, because you don't have one or two kids, anything you want to do, any place you want to go, anything you want to relocate, if you want to do it, it will be easy to move from place to place, maybe relocation or anything. So it's very, very important. It increases social mobility. So now let's look at what are the demographic benefits. Demographic benefits. Of course, that one is this one I'm about to say now is common. Population control and stabilization. Yes. Overpopulation leads to a lot of things, a lot of negative things in society. So if families are able to plan well before giving birth, or even while giving birth, they plan well on the number of kids they have, they should have. Then you see that the world, there will be no overwork. The whole place will not be overpopulated, and there will be stability. There will be stability. Just consider here now. Just this class now. You have this class is overcrowded. Everybody here will not be comfortable. There will be no stability here. So think about it now. when if everyone is overpopulated, no career opportunity, job opportunities will be what? Minimal, will be low, because before you say Jack Robinson, 20,000 have applied, and a lot of okay, a lot of things are involved. Just look at there may even okay. It may not directly be the threat, the cause, but just look at some people that went to share rice, to collect rice, Christmas rice in one of the states here in this country. On getting there, the whole place was overcrowded and there was stampede. A lot of them died. So overpopulation is not a good thing. So, but if you plan well, if our families are planned well, there will be what? Population control. Now, it also what? Reduces what? There's what? Reduce what? Fertility what? Rates. And also improve age structure and reduce migration pressure. When I mentioned mobility, you can easily move from one place to another place. And now the same thing now is also there, but we are looking at it from the demographic point of view. If you want to migrate, what we call it relocation, this they're talking about the same thing, but in different context, different what names, different what name, but they're talking about the same thing. Migration, location. If you want to migrate, migration pressure will be what? Low, because you don't have much people to do what? Compare. All right, so now let's look at the environmental benefits. Of course, environmental benefits. Of course, look at our environment. If the whole place is crowded, it will mess up. We have sanitation will not be far-fetched, because every place will be messed up. The earth of things. So there is reduced resource depletion. If you plan your family well, if we plan our family well, our families well, there will be reduction in the resources. The resources we have will be one. It will be available for everybody, and there will be no depletion, because we don't have, people are not that, we are not overpopulated that we cannot have access to our what? Resources. So there will be no scarcity of what? Resources. And there's improved environmental sustainability in terms of the sanitation. Even structures in the environment will preserve, because when you are overpopulated, that's where a lot of things do that nuisance. People just look at structural government properties and go and just vandalize it, because they have no job, they are hungry, they just vandalize it, take the metal part of it and go and sell, because everywhere people are hungry and there are many people in the society doing nothing, and they lack basic home training, because their parents we are busy looking for what to eat. No time to even train them properly. They were trained by the streets. So there will be what? Improve what? Environmental sustainability if we plan our families well. Okay. Of course, now we know that we have climatic changes, good. But if our family are planned well, we have reduced climatic what? Changes. The effects, the impact of climatic change will be what? Reduced. Yes, because when we are overpopulated, a lot of activities of this population may affect the what? The climate. Yes. Of course, now next one is what? It ensures conservation of natural resources. Of course, when people are when the whole place is overpopulated, people must survive, and they start looking for how to survive. They may start tampering natural resources, reserves, so as to do what? Survive. So in that case, if we have, just go to the society that we have control, that have control in the birth rate, control in the family, every family. Before you even think of getting married, you know about family planning and how many kids you should have based on what you have. You see how the society is. The society is serene. society is what? Stable. They have their natural resources well preserved. That are only used, those resources are used when needed for the good of the entire world, society, not just for hungry, untrained, and the deviant few or crowd that want to survive because they lack what is called basic home training, because their parents didn't have the time to do that, because by 5 a.m. they're out looking for small menial job to do to be able to feed them. In the evening, night they come back. What their children did from 6 a.m. to 7 p.m. they don't know. Some don't even go to school because no money to pay their school fees. All right, so this is all we have in the advantages and what? Disadvantages of family planning. Now, let's look at another thing. Another subtopic. We are done with what? Advantages of family planning. So next one we look at stimulation. Stimulation of acceptance of family planning services. So look at what next subtopic is what? Stimulation of acceptance of family planning services. Yes, a lot of people don't like this family planning issue, so they need to be stimulated. What strategies do we employ to be able to stimulate them, make the reasons why they should plan their family? So here are some strategies that we need to use to stimulate acceptance of family planning services. Yeah, so we also group them as follows. We have the community-based strategies. Community-based strategies. Number one, look at what? Community outreach and education. You go for community outreach, reach out to people, group of people, talk to them about importance of what? Family planning. Yes, that is health education too, with respect to what? Family planning. There's also engagement of the world, community leaders and influencers. Yeah, those that can be able to help to do what? Make this community to, key in into the what? The family planning is services out acceptance. So you're also not just talking about going for outreach, you also engage the community leaders and also the influencers. Another strategy is peer-to-peer education and support. Peer-to-peer education and what? Support. Peer-to-peer education and what? Support. The next one is what? Cultural sensitivity and what? Adaptation. Cultural, we talked about cultural sensitivity almost every class you started to discuss, so I wouldn't go into it again. Cultural what? Sensitivity and what? Adaptation. We also apply collaboration with local healthcare providers. We have PHCs there. We have other healthcare providers there. Local, you want to localize in a particular area. You partner with them, you collaborate with them to be able to do what? Achieve that. So these are what? Community-based strategies we can use to stimulate acceptance of what? Family planning services. The next one is what? Client-centered strategies. Client-centered strategies. Yeah, of course, you're not just talking in the air. One-on-one with your client, you should be able to do what? Make whatever we are discussing with the patient to client to do what? Confidential and non-judgmental services. Confidential and what? Non-judgmental services. Of course, now you talk about counseling. Counseling is also there. Counseling, but that counseling is not just counseling in the air, making the client centered. But of course, once it's counseling, whatever counseling you are giving has to be with respect to the what the client you are what talking to. So make out time one-on-one, and as you see, because some may have the reason why they don't want to do this thing. Yes, some may have the reasons. Some maybe religious whatever belief. Some may be cultural. As remember I mentioned under community based, I mentioned cultural sensitivity. Yeah, so maybe cultural, maybe because of their cultural background, they don't want to do anything with family planning. There are some religious organizations that the only family planning they know is what? Natural. So if you come in contact with such people and that you find out that natural is not working for them, so how will you now be able to convince them to go to the other one that is not other ones that are not what? Natural? So this takes a very serious work to be able to achieve that. Now, so you also look at informed choice and decision what making. You have them to be able to decide on which one to do what. You not just telling them about it and disappearing. You be sure that you help them to be able to do what, take the decision on what to do. But of course now, because you have actually told them the pro and cons of the issue of family planning, what are what they stand to gain, or what are what they stand to lose, or issue they stand to have if they don't plan well. You are seeing them to make what, an informed decision on what to do. Of course, whatever you are doing must be what, accessible. You must be what, accessible. The services must be what, accessible and what, affordable. These things, if you are telling somebody to go and do a family planning method, that the person will not even see where to get it, where to access the family planning method. Will it work? It will not work now. Especially those that are not going for natural one. Tell me if it not work. So whatever you are giving, there are the strategy that will stimulate them to be able to start that family planning service or accept it. Is that, are they, this thing, is it accessible? Is it affordable? Very important. Now, of course, now you also follow them up to know how far they've gone. It's not just to start them, make them to accept it and disappear. You follow up. So we talk of what? Follow up and support services. Follow up and what? Support services. Now, we, apart from, aside community-based and client-centered strategies, we also look at service delivery strategies. There, of course, here now, this one now, whatever that has to do with family planning need to be integrated into the what? Reproductive health services. Of course, that's why when we talk about reproductive health, you must definitely talk about what? Family planning method. So integrated family planning and the reproductive health service. Then the next one is what? How the next one that will do what? Help stimulate them to accept it is under service, under this service delivery strategies. We have mobile health clinics and outreach services. You mobile health clinics. Of course, you know what is mobile health now. Mobile, from place to place. Mobile. Some may be in a very big what? Vehicle. Some may be a detachable, whatever they have, they keep it after, just like post. Even though post may not actually be that mobile, but there are some that you can still move from place to place. That's what I mean by what? Mobile. Or basically, when you hear mobile, it means that everything is in maybe a very big vehicle. You get to a particular place, to this community today, everybody, they set up their stand and do whatever they want to do. From tomorrow, they go to another place, from place to place, and active services. So this that is breaking into their doorsteps. So this will go a long way, helping to do what? Stimulate acceptance. Okay. Next one is what? Telemedicine and online services. Telemedicine is actually taking the lead now. Yes, at the comfort of whatever office, the person can stay to telemedicine, the person, whatever services the person needs, the person can get it. So it will help to do what? Stimulate to what? Acceptance. Of course, now most of this issue of course, most of the women and the reproductive age they are still youths, and also even adolescents that are still coming up. Even though yes, we can be talking about marriage, but it's also important for them to know about family plan even as they are coming up. So youth, everything that has to do with everything that is youth friendly, all the services that you want to give, any strategy that you want to apply to be able to make them accept these family planning services need to be what? Youth friendly. It will go a long way at improving their what? Acceptance of this thing. A very important one, very, very important one that we seem to neglect, and that is causing very, very serious problem in the families. That one is the male involvement and engagement. Some husbands are not even involved. Some husbands, their wife don't even involve them, maybe because they are afraid that if she mentions it to them, they will not agree. Some, their wife will be dragging them to get involved, but they don't even care. Now tell me, how will it work? How will it work? So, in order to stimulate acceptance, the strategy, very important, is to involve the husband. Getting the husband involved to help the wife, for the future that the two of them, the husband and the wife, the man and the woman, will come together and take a decision on what to do and how to take for instance now, if the family want to, if the maybe because of their religious sentiment, they prefer natural family planning where they look at their menstrual cycle and when the ovulation is coming and when to have sex for the purpose of giving birth, and when to have sex for the purpose of just the intimacy, not for giving birth. Now, if the husband doesn't even know the menstrual cycle of the wife, how will it work? Or even if he knows and he doesn't care, he believes he can have sex with her anytime he wants, that's probably they cannot plan that family properly. But if the two of them agree on it, maybe if the husband would want to touch her, you say no, this is not the time. They go and check whatever where they plot it, or whatever app they are using to check the menstrual cycle of the woman. The other will say, it's true, let me control myself. We are not going to do anything today. You see it now, because they agreed. The man is involved. Sometimes the woman doing ovulation may be in need for sex, may actually, the sexual drive may be more that he wants to. He may even forget whatever they have agreed and start touching the man that he wants. The man may remind her, baby, look at, have you forgotten what we agreed? Do you want us to give birth, have a baby now? Once he mentioned it, the woman will remember what it means to have a baby again. For the next 9 months, all the drive will go down too. Because they agreed and took a decision on the family planning method they want to use. This system goes in other methods. Now, that's why it's very important for the male to be involved. Himself, some bachelors, those that are not even gotten married, should know about this too. So that by the time they will get married, it will not be a new thing to them. Alright, so that's all about what service delivery strategies. Now let's look at policy and advocacy strategy. That is where we start talking about different policies and funding and what have you. Here we talk about policy support and funding. That one is there. Without that, it's not work. We talk about what? Advocacy and awareness campaigns. Of course, different campaigns about it. People will know about it, and then it will help to do what? Stimulate people's what? Acceptance. Now, of course, The next one is to address, because as I said before now, a lot of people have different sentiments towards different family planning methods. So there's need for awareness, or the need for the social and cultural barriers to be addressed. So maybe their culture, some is only nothing, you cannot use anything, just natural. So these things need to be addressed, and if properly addressed, it will help them to make an informed decision on the family planning method services to go for. Then of course, now training and capacity building, very important. Then monitoring and evaluation, also very important. The next one is evidence-based intervention. Let's look at evidence-based intervention. Here now, of course, this one is a lot of things are involved here, ranging from community-based distribution of family planning methods. Yeah, in fact, from different places, a lot of family planning method devices or years are being distributed from one place to another, so as to help people to have access to these things. Okay. Of course, peer education program. I've mentioned peer-to-peer, but this one now is more organized, because you're talking about evidence-based intervention. So mobile health services, integrated family planning, and HIV service. I've mentioned this before now. So male engagement and involvement program. We're not talking about making this now as a program now. It's not just about talking about it in the end. Male engagement, we are not making it a program now, an event, a program planned out to get it done now. So that's why they are under evidence-based interventions. That's why they are under evidence-based interventions. All right, so that will be all for family planning. This is where we draw our curtain in family planning methods. This is where we draw our curtain on the family planning method. So, the next topic I want us to look at is we will look at the roles of pharmacy technician in maternal and child health. We look at the roles of pharmacy technician in maternal and child health. The roles of pharmacy technician in maternal and child health. Look at the roles of pharmacy technicians in maternal and child health. Now, pharmacy technicians play vital roles in integrated community case. They are different. We look at the roles in different perspectives. We look at it and the integrated community case management under maternal and child health, and improve and reproductive health services, integrated community case management, integrated maternal child health, and the community health services. So, as being reproductive health services, not community health services. Now, let's look at the integrated case management, ICCM. So, what role does pharmacy technician play in integrated in integrated community case management. Integrated community case management. All right. So now, the first rule is that they are involved in ambience, please. All right. They are involved in dispensing medication for common illnesses. They also provide education on disease prevention and management. Even at that level, they can still provide education in disease prevention and management. It will not be all the diseases, but at least some self-limiting ones. Yes. All right, so they also support the community health workers. Yes. Pharmacy technicians support the community health workers with medication management, in the aspect of medication management. So pharmacy technician can support the community health workers with respect to medication management. Of course, they maintain accurate records and reporting, because what is not documented is not done. What is not documented is not done. As you are doing it, you document it. So they maintain accurate record and reporting. They also ensure medication safety and quality. So pharmacy technician also ensure safety and quality of the medication. Very important. So these are what they do in the integrated community care case management. Now let's look at the integrated maternal and child health. So what role does pharmacy technician play in integrated maternal and child health? They are as follows. Pharmacy technicians help in dispensing essential medicine. Very important. You cannot talk of grassroots level or whatever without mentioning essential medicine. And yes, so pharmacy technician dispense essential medicine for maternal and child health. They also provide counseling. Yes, counseling. It may not be that complicated ones, just one or two things. In terms for counseling on family planning, reproductive health, and nutrition. Yes, they may not do it as a dietitian or nutritionist, but at least one or two things with respect to things that revolve around what will help them to work for the drug they are taking to be able to work well, or you yourself food to even avoid while taking a particular drug, because we also have food to drug interaction. So pharmacy technicians should know one or two things about this. So they do that in integrated maternal and child health. Of course, they also support the community health workers with maternal and child health services. Everything, mostly especially when it comes to medication. Now, they also conduct health education sessions for mothers and caregivers. I think I mentioned it before. They can also educate them at their level. Now, of course, they also in maternal and child, integrated maternal and child health, they also take care of ensure that they keep accurate records of whatever services, especially with respect to medications issued or dispensed, as the case may be. Now, let's look at the mama kits. So what role does pharmacy technician play in ensuring and the keeping and the distribution of the mama kits? What are involved? Now, pharmacy technician, they assemble and at the same time dispense mama kits. Yes, pharmacy technician also they assemble and they dispense mama kits. So mama kit just contains essential items for safe delivery. Essential items for safe delivery. Now, I want to give an assignment. We'll discuss it in the next class. Research on the content of mama kits. Research on the content of mama kits. Research on the content of mama kits. And tell me what you think. What will you be able to, retrieve on that. Now let's continue. So, pharmacy technician assemble and dispense mama kits. Basically, I want you to know here that mama kit contains essential items for safe delivery. So do the rest. So pharmacy technician also provide education on the proper use and maintenance of mama kits. Proper education on the proper use and maintenance of mama kits. So pharmacy technician also ensure accurate tracking and reporting of mama kits distribution. Not only that they assemble and dispense, they provide education on how to use it to properly. At the same time, they track the distribution, the movement of the mama kits. They also collaborate with community health workers to distribute mama kits in community settings. In community settings, Farmers Technician can also work with community health workers to distribute what? Mama kits. And they also monitor and evaluate the effectiveness of mama kits programs. Yes. So for Farmers Technician, most of these things at the primary health center, of course this is primary health care. Most of these things are at the grassroots level. Farmers Technician has a lot of work to do at this grassroots level. Very important. So please get ready for it. At the grassroots level, we have a lot to do in the primary health care. So very important. So let's have this at the back of our mind. So let's look at the roles of Farmers Technician with respect to family planning. Basically, as let now hit the nail on the head. Family planning and reproductive health. What are the roles Farmers Technician play here? Now, Farmers Technician dispense family planning. Farmers Technician dispense family planning commodities. Yes. Farmers Technicians dispense family planning commodities. We discuss this family planning commodities. So let's go straight to the next point. They also provide counseling on family planning and reproductive health. I've mentioned that. They can do that at that grassroots level. They can do that. They can also support community health workers when we come to family planning services, medication and other things. They also conduct, I'm repeating what I've said before now, they also conduct health education session for family planning and reproductive health. And at the end, they maintain records of whatever that is carried out when it comes to with respect to pharmacy in the family planning and reproductive health. Now with this, we've come to the end of roles of Farmers Technician in maternal and child health. The next topic I want us to look at today, we are going into an entirely new topic today. And that topic is what? Definition and care of the aged. Care of the aged. Care of the aged. Care of the aged. Now let's look at care of the aged. Before we go into the care of the aged, we look at who is an aged person. Of course, if you say that somebody is aged, old age, start from 65 up, that old age. Now, having known that now, because in this topic we are going to categorize different, of course, old aged people are also known as what? The geriatric patient, geriatric clients. So now, just as we have the pediatric, they are the geriatric. We still look at their categorization. But for now, I want us to define what we mean by care of the aged. What does it mean? Care of the aged. Care of the aged. What does it mean? Care of the aged. So care of the aged refers to the provision of support, assistance, and services to the older adults. Care of the aged refers to the provision of what? Support, assistance, and services to older adults who require help with daily living activities, health care, and social interaction. Care of the aged is the provision of support, assistance, and services. Support, assistance, and what? Services to the what? Older what? Adult. So why do we give them these services? Why do we give these services to the older adult? Because they need help with daily living activities. What are these daily living activities? Bathing, eating, walking, going to toilets, all those things are daily living activities. So they need help with the devotion to water, their daily activity, and also health care and social interaction. So this is the definition of what care of age. Once you start providing support, assistance, and services to people older adult from 65 years up with their daily living activities, daily DALs, with their daily, hope I got it, daily living activities. Sorry, DLA, sorry. DLAs, with D what? LAs, daily living activities. Then, health care and social interaction. You are caring for the aged. So anytime you are doing any of these things, let me repeat myself. Anytime you are providing support, assistance, and services to an adult that is 65 years and above, older adults, with their daily living activities, their health care, and their social interaction, you are caring for the aged. Because sometimes social interaction, because sometimes they may not be able to interact again, their cognition may go down, decline, so they may not be able to interact properly again. If you help them to achieve that, you are caring for the aged. If you help them with their daily living activities like going to the toilet, walking around, bathing them, changing their clothes, you are helping them with brushing of the teeth, you are caring for the aged. Even with their health care, taking them to the hospital for proper checkup, and they calling the doctor to come out to the house to take care of them, you are taking care of the aged. I believe this is clear. I know why I broke it down like this, so that we understand it. Now let's continue. So the care of the aged encompasses the following. I mentioned them, but let me just repeat them again. Assistance with activities of daily living. In some texts you see it as daily living activities anyway, or activities of daily living. Any of them is okay. So what are these activities that I mentioned there, like bathing, dressing, and feeding? So it encompasses the following: assisting them in the what? Daily living activities, like bathing them, dressing them, and feeding them. It also encompasses management of chronic health condition. They are prone to chronic health condition. At that old age, all the lifestyle from your young youth age to that level will come back. So you see some of them having diabetes, some having arthritis, some having hypertension. Yes, even though yes, they may have hereditary under too, but most of them, why it appear like that is because of how their lifestyle when they were younger. So we are drinking alcohol in the way they like, so we are consuming sugar, so we are not doing enough exercises. All these things come up at old age as chronic diseases. So if the time you are having the management of their chronic diseases, you are caring for the age. I'm telling you, I mentioned this, but I'm just talking about it in a more organized way. I just broke it down doing the definition. Now, another services that is involved in taking care of age is we have the one we have provision of social support and companionship. Hey, very, very important. Companionship. Some of them are too lonely. Some of them will say experiencing depression. They are lonely. They cannot interact socially the way they used to before. They will stay at home. Event, occasion, they will not be able to go to occasion again. When others go out, they will stay alone. Companionship, very important. Companionship, social support and companionship. Anytime you are doing that, you are caring for the aged. I know I am repeating myself, but I want it to sink. That's what I'm doing. That's what I'm taking it this way. The next one is what? Assistance with medication management. I think I mentioned that. Medication management. Then support with mobility and transportation. Because some of them may not be, their mobility will decline. So as you support them, moving from place to place, taking them to hospital, taking them to the church, taking them to different places, you are caring for the aged. So why do we care for the aged? So the goal of the care of the aged is to enable older adults to maintain independence, dignity, and quality of life. The goal of care of the aged is to help these older adults from 65 years up to maintain their independence, dignity, and quality of life. Before we go deeper into this, let's look at aging, types of aging. Let's look at aging, types of what? Aging. Let's look at aging. Types of what? Aging. Types of aging. Another name for the process of aging is senescence. Another name for aging is what? Senescence. Senescence is another name for what? Aging. Okay, so basically what is aging? The process of aging, also known as senescence, is a complex and multifaceted phenomenon. It affects all living organisms. Whether you like it or not, you must age. But the rate at which we age may not be the same thing, based on how my lifestyle or exposure to one disease or the other may change the rate at which I age. But whether you take care of yourself properly or you don't take, you must age. Age is a natural phenomenon. You cannot escape it. But the rate may differ. So that's the point I'm trying to make. So I say that the process of aging or senescence is a complex and multifaceted phenomenon that affects all living organisms. It is characterized by what? Decline physical, cognitive abilities. The person cannot do the physical things he used to do before, go from place to place, activities he used to do before. That's why you see them needing people that will assist them in the activities of their daily life or daily activities of their of living. Yes. So they cannot do it. Then cognitive, some of them may go into dementia. They may not be able to. They cannot remember anything again. Sorry, they can't remember anything again. So one is that they have declined physical ability, cognitive ability, and they are also prone to what? Diseases. Their susceptibility to disease will do what? Increase. Of course, ultimately, they will die. Ultimately, they will do what? They will die.